my name is Brittany, and I'm going to be doing a video on wound packing, wound culture, and a sterile dressing change. Okay, so I've walked into the room, I've introduced myself to the patient that I'm going to be the nursing student today, and I'll be doing this procedure on them. I identified them with a name and date of birth. Coming in, I'm washing my hands. I'm going to ask if they would like any pain medication or anything like that before the procedure. And then I've looked at the doctor's orders to make sure that there is the wound packing and sterile dressing change order there. And if there is any pain medications given 30 minutes before the procedure to make sure that they kick in for the patient. All right, and then I'm going to also, before I do everything, I'm going to educate the patient and tell them what exactly that I'm doing and that it might be a little bit uncomfortable or anything like that. And tell them just it's normal, and if it gets too painful, just to let me know. All right. So I have already, I've already taken off the Band-Aid off my wound. This is my wound, it's a tissue box. I assess the color, the drainage, the odor, and like the consistency, and if there was a lot of it. And I'm going to document that. I have, and then I took off all the old packing and I have disposed it. And before I irrigate the wound, I'm just going to measure the wound that I have everything out. I have my measuring device here. I'm going to measure the length, width, and depth of the wound. And then I also have Q-tips in here, and I would measure if there's any tunneling in the wound or anything like that. I would take the Q-tip in, and I would measure it, and I will document that. Now I'm going to get my gloves on. Have the patient lay on their side. I'm going to put this draping the patient so that way they don't get wet or anything like that. Okay. I'm going to open a gauze to catch any of the liquids or anything like that, and then I have a couple other gauze to wipe it later. These opened up. Sterile saline. I'm going to check to make sure it's not expired or anything like that. And I have my irrigation tray, which I'm going to pop up. Pour a little out first in my biohazard bag. I'm going to pour a little in here and have the patient lay on their side, and I'm going to irrigate the wound. Now I'm going to irrigate until the solution I see is clear coming out. So I'm going to make sure there's no debris or anything like that. It should be, once I'm done, the solution that will be clear. Now that I have now that I've irrigated the wound, I also like clean the wound, and when I clean it, I would clean it from the clean side to the dirty side. After I do all this, I'm gonna get a wound culture. I get a wound culture after everything to make sure there's no like dryness from the skin. I actually want to see what bacteria is on the wound. So I have my culture stick. I'm going to get a culture. I'm going to put the patient's name, date of birth, the doctor who ordered it, and also where the wound location is, and that it is a wound culture. And I'll have it back, and I will send it down to the lab. Okay, now that is done, I'm going to take off my gloves, and we are going to pack the wound, and I'm going to pack it with sterile gloves. My hands. I'm going to get stuff ready that I need, like gauze. I'm going to have them open like this, so opening them here. Suture tray here. And the wounds things here. I have them opened up on the side. Gonna check again, and I'm going to discard that, and I'm gonna put a little solution onto my little pads, the gauze and stuff like that. And I'm also gonna put a little solution in a tray just in case they don't get wet enough, and I'm going to dip them later. Have everything open here, not breaking sterility. And okay, I would have crossed over and broke sterility going over my suture tray right there, but instead I'm going to come around and take the gloves, not breaking sterility, and I'm going to don my sterile gloves. Good. We're going to discard this into the biohazard bag. Now that I have my wound, I'm going to take my sterile forceps, and I'm going to take this, and I'm going to pack the wound. Now I already dipped them in. I already put sterile saline in it, and I'm just going to pack the wound. And I'm going to not pack on clean, good, healed skin. It's only on the damaged wound. And then I have this. And then when I pack, I try to leave a little tail out so that way this can be pulled out. Discard my forceps. As well, at least I have my abdominal pad that I'm going to put on. Now, I messed up in the sense I should have opened the abdominal pad beforehand, so that way I didn't have to with the sterile gloves. Just taking the corners of it. I'm going to put the pad on. blue side up. And then we are going to tape the wound on all corners. So I'm going to tape this to all four corners, and on it I would put my name and the time that I did it and the date. After this is all done, I would document again any findings, any discharge, how the patient tolerated the procedure, if they needed pain medication or I needed to administer anything. Some things that could have gone over better in the video is that I could have done a little bit of better sterile technique. I had everything open on the side. I don't know, it's kind of hard to watch, but everything in the packaging open, ready to use. I didn't set up a mat or anything like that because as long as it's in the package, it is sterile. What else? That's it. And then, like, again, measuring the wounds and everything. I think I got everything.